People, organizations, and institutions throughout the world desperately need market-based solutions to the world's wicked problems in health, water, food, energy, learning, infrastructure, waste, security, and climate change. We created 10-10-10 for serial entrepreneurs to support them as they create new market-based ventures that tackle these wicked problems. We bring these prospective CEOs together for 10 days. We introduce them to one another and to the 10 wicked problems we previously identified with the help of industry partners.
I'm just incredibly grateful for how much work goes into us even being able to show up for 10 days. For 6 months, people are working on these problems and doing research, and then we show up and we get enormously well-researched information. Countless hours and nights went into that, and that's just a really cool experience. When in your life do you get an opportunity to meet with problem experts in 10 different areas that are incredibly important in improving the health of our society? People that have dedicated their entire lives to one specific area. Having the opportunity to sit down with them side by side and to hear their passions, their concerns, what keeps them up at night has been really the opportunity of a lifetime.
Welcome to 10-10-10. I'd like to introduce Cheryl Kelnhofer, co-founder and CEO of Apostrophe.
They should have let me pick my own theme song. I wouldn't have picked that. Thank you so much for having me
People,
here today. My company, Apostrophe, we're building the health plan that's fixing America. Don't laugh, it's for real. So healthcare costs America so much money. It costs people so much heartache. But the problems on healthcare have actually been solved. The biggest, largest, most innovative employers, people like Boeing and Lowe's and Walmart, they've cracked the code on how to provide better benefits for less money to their employees and their employees' family. My company, Apostrophe, takes what they have done and have made it plug and play for employers of any size. I was in the first cohort of 10-10-10 back in 2015. Since that time, my company, Apostrophe, has grown from a spark to $3 million in revenue, serving 60 employers across 42 states. We've raised $7 million in venture capital from folks like Norwest Ventures and Blue Cross Blue Shield. And we've got 38 employees in Denver. And not a... And absolutely none of it would have been possible or would have happened without 10-10-10. And I'm super serious about that. Tom called me on probably my very worst day. I had just moved to Denver. I was shutting down my existing startup, and I was in the darkest place I could be. And it hadn't mattered what I had done before. Hadn't mattered that I had a Silicon Valley career and shipped almost $1 billion in new product. Didn't matter that I took my current startup from a $400,000 Kickstarter to the top-rated product on Amazon. I was feeling pretty shitty because I was failing. And he brought me in the last minute into 10-10-10 as one of the prospective CEOs. And I had 2 weeks that just completely reinvigorated me. It focused me on a new market area that I learned really needed my expertise as someone who knew nothing about healthcare. I was going to be tremendously valuable to this place because I didn't know all the screwed up things they had already done. Gave me my mojo back, gave me my swagger back, and I don't even remember what the wicked problem I attacked during the program was. I think it was Alzheimer's. Yeah, right. Oh my God, did I just make that joke and not mean to? Oh my God, it's such a corn dog. I felt so great after the program, though. What I promptly did is take a 6-month sabbatical because I needed to wind down from my last company, trained for an Ironman, but came back in the fall after that program and quickly found out that I didn't pick the right problem for me. There wasn't a great synergy with what my brand was about and what got me fired up. But because of the network 10-10-10 gave me and the resources I knew that were out there and the spark I had to attack a wicked problem, I found the problem that was right for me. And I found it because I started reading Dave Chase, who probably a lot of you healthcare people know. He writes a column, and I stumbled upon his case study about Rosen Hotels, the hotel chain that invented their own benefits program. And that benefits program improved the health of their employees, improved the retention of with their employees, improved the net promoter score at their hotels because their employees were healthier and happier, and did so with such a dramatic cost savings that they now provide free college tuition for all their employees and their employees' children. Right? And I saw that and I said, oh, health, yeah, I want to do that for everyone. And that was all because of 10-10-10, but it's been a long journey. I figured that out a year after we did the program. A year after that, my team of 6 with our paid pilot customer went into Techstars. A year after that, we shipped our whole complete platform, and it's a year later when I can point to those revenue numbers, those customer numbers, and that investment. So I think as we look at the program and the new Prospective CEOs here today, everyone's going to find their own path. I think the most important thing is that you find the problem that fits you best as a founder and then let it unfold before you. And with that, I'm supposed to announce something that I probably am not doing correctly yet. I'm supposed to introduce Tom Higley. He's going to come up here next. I should have studied harder on this one.
So I can't tell you how pleased I am to see you all here. Thank you so much for coming today. I'm going to ask you to give Cheryl a hand. I'm going to say some things about her in a minute. You can hold the applause until after that so that you have some context. But what you should understand about Cheryl really is that she came into the program on days' notice in 2015. She had moved to Boulder from Palo Alto, and when I reached out to her and called her after she requested an invite, she really jumped at the opportunity to step in. But the thing is, this had never been done before. We've not done anything like this. So she really took a chance when she stepped in and served as a prospective CEO in that first cohort. And the thing about Cheryl is she focused deeply. She truly was present during the whole time, and she dug deep. But the first lesson that she taught me, and this is the one I learned the latest, but it was the first lesson, was how important founder opportunity fit is. So that notion of founder opportunity fit isn't a common parlance in the industry. We talk, entrepreneurs do, about something everybody knows in the entrepreneurial space is product market fit. So everybody knows what product market fit, and everybody knows what that means in the entrepreneur space. It's, oh, I found traction. I know that I have a customer who's willing to pay for what it is I'm creating. But what we've learned, and Cheryl helped teach us, along with others, is that notion of product market fit and a whole lot of ways we think about things live on what we call the right side of the bow tie. How many here have heard us talk about the notion of the bow tie, by the way? Hands up. Okay, quite a few of you. For those of you who have not, let me just say it this way. I want you to think that a venture starts at the moment of the knot in the bow tie. And right after that knot, there might be an accelerator, there might be seed financing, but the right side of the bow tie is about scale and growth. It's growing your customer base, growing your revenues, growing your capital base. And I'll tell you that in the last dozen years in the world of startup culture, in terms of what we've learned, the thing we focused on is that knot in the bow tie and what comes immediately after it. That's been the whole notion. And that was awesome. We needed to learn that. But I'll tell you this, the tools, the language, the vocabulary that applies to the right side of the bow tie is different than the set of tools and the language and the understanding that belongs on the left side of the bow tie. So what's the left side of the bow tie? The left side of the bow tie is essentially the missing entrepreneur's due diligence process. Most entrepreneurs on the planet do what they do when they're thinking about their next venture on an ad hoc basis. They sort of, talk to people they know and the things that they've heard, and they have ideas, and they test ideas in conversation. But it's pretty catch as catch can, pretty ad hoc. Or they're entrepreneurs in residence or something like that. But this left side of the bow tie is way more than that, because the folks that are here, the 10 prospective CEOs right here, they are all about to invest the next chapter of their lives in something. And so, the due diligence that they perform in that context, that should be more serious due diligence than we see when a venture capitalist is going to put $1 million or $5 million or $10 million into a venture. Because when they invest the next chapter of their lives, they're not diversified, most of them. They're all in. All their eggs are in a basket. So they have an incentive to figure out what the next best thing should be for them. And that's where the right side of the bow tie language fails. Just doesn't do the job at all. And the language we've come up with, and that we talk about, is first the idea of listen and learn. And second, the notion of founder opportunity fit, really thinking about your values and perspectives and thinking about whether the problem you're solving, the customer for whom you're solving it, and the solution you're bringing map in some significant way to who you are and what you care about in the world. Because if that's not true, Cheryl can testify. You may decide Alzheimer's is a great problem to solve, but decide after maybe a few months that it's not for you because that's not your thing. That's what we do. We focus people's attention on things that are about that founder opportunity fit. So Cheryl helped teach us that. Others have helped teach us that too. The other thing she helped teach us, is that in the second cohort when we did the program, and this was a big deal, the second cohort, I stumbled badly. She pointed out that the bar that I'd set and the things that I required of people were keeping the diversity out of the cohort. It was a foolish thing that I'd done, and I hadn't understood it until she pointed out. She said, Tom, pay attention here. If you had required the same things of me that you're now requiring of this cohort, I wouldn't have been in the program. Well, that would suck. So I learned two really valuable lessons from Cheryl, and I want to tell you that I've learned valuable lessons from every prospective CEO who's joined us in this process over the course of the 6 times we've done this. So let me pause for a second and just say, everything we do is made possible by a set of sponsors. We could not do what we do without them. They're huge for us. So the Colorado Health Foundation has funded our health-related programs over the course of the last 4 years. The Robert Wood Johnson Foundation is a powerful sponsor for us this time around, and we're really happy to have them here. By the way, I'd love to ask sponsors to stand up and be recognized. So I know someone from Robert Wood Johnson Foundation is in the house. Would you please, Melissa? Thank you. If there's anybody from the Colorado Health Foundation in the house, would you please stand up? So, Zoma Foundation has really been a significant contributor. Kara? Rose Community Foundation, a significant contributor. Cielo Foundation and Denver Foundation, significant contributors. So I'm going to go through the rest, and I'm going to say these pretty quickly. Delta Dental has supported us again and again. Denver Health, Denver Office of Economic Development, KO Law Firm, Perkins Coie, and then a whole host of in-kind partners as well that I'm really appreciative of. You'll see them on the rolling chart that goes through here, and I just want to thank all of you. Again, just an applause for all the sponsors. Thank you very much. All right, so I want to make sure that you all know what this is and what it does, what success is for us, and then I'll pass the mic, and the stuff that we really care about can happen. We're successful if the prospective CEOs who join us find value in what we help create. As a first step, we're successful. If they don't find value and we don't get to bring in a great cohort of prospective CEOs, we don't get to keep doing this. So that's the starting point. And that's the first thing we can measure on a timeline. But ultimately, if that's all there is, if they're happy and excited, that's a really important thing. But if you're happy and excited and nothing else happens, we really will think that we failed for you and for us. So what matters in terms of our gauging success is their success. And what that's really about is that they found some kind of founder opportunity fit. They create a venture. That venture is funded. There's some kind of return on capital for the funding, and there's impact. And the impact piece is really important. If it's just return on capital, that's pretty much like what a lot of other folks do. And we're not that. And let me just say in brief why and how we're not. The problems that we choose are not the problems that most entrepreneurs on the planet are working on today. And this is really, really important. We're focused on complex adaptive systems, and we're focused on the problems that live within those systems. Most entrepreneurs are still dealing with tame problems. I want this result, I do this thing. If I do these things in between, I can make this thing create that thing. It's pretty, I mean, it's still kind of hard to do, but it doesn't change the world in any meaningful way. That's not what this is. So we're focused on the complexity that is health, and you'll see that. You'll see that in the course of this context. So complex adaptive systems harbor, foster, nourish, feed wicked problems, and wicked problems will persist unless and until someone's willing to tackle those problems, and that's really what our mission is. Our mission is to tackle the world's wicked problems through public education and engagement that inspires entrepreneurs to action. So we will be successful if they're happy in the program, if they start new ventures that return capital, but also if they address the wicked problems in the world, and that's really what we're learning to do. That's what this whole thing is about. You don't need to hear a whole lot more from me, but you do need to hear that we've had success as we do this. So in addition to Cheryl Kelnhofer, Frank Ricotta in that very first cohort started Burst IQ. Frank, if you're here in the house, would you stand up? You got to be here someplace. Yeah. Thank you, Frank. So Burst IQ focused on blockchain and on health data and delivered something really powerful right out of the gate. I think Frank started his venture in 60 days or less. And now, one of the ventures from the second cohort, Concert Health, has just concluded raising a round of financing, $2.2 million, led by the founder of Optum and by Andy Slavitt's venture firm. Andy was the administrator for CMS. So Concert Health is another example of success. I can also speak to Upsuite and to Spout, which actually helps Folks like the folks in Flint understand what's coming out of their tap water in real time, that spout. I can also speak to Recalibrate Health that's beginning to really assess toxic stress in real time, giving folks a tool to understand what's actually happening in terms of stress. So we're really thrilled with what's happened so far, and there's lots more to come. Lots more to come. I said this earlier to folks, and I'm going to conclude with this. Archimedes said, give me a lever and a place to stand, and I'll move the world. For us, serial entrepreneurs are that lever. Serial entrepreneurs have the capacity through investment and through exploration and through the work they do to actually move the world. And we want to give them the tools to be able to do that. We want to put wicked problems in front of them, give them the tools and understanding to move forward, and inspire them to do the things that we'll talk about today. So I've had enough airtime here. I think it's now time for me to surrender this microphone and maybe let you come back and go on with the show.
My job here today is real easy. I think I'm going to start doing this instead of my day job because it's much easier. What we're going to do next is what I think is the most exciting part of the afternoon, and something I got to do briefly upstairs beforehand is meet the next cohort of prospective CEOs. And you guys all know the drill: 2-minute pitch, name where you're from, what your mojo is, right? And we're going to start with Danny.
Good afternoon, everyone. I'm Danny, and like the rest of you, I am Homo sapien. That means that I feel a whole range of emotions, ranging from love, pleasure, joy, and also some emotions that I don't like to feel sometimes, like anxiety, fear, insecurity. But unlike the rest of humanity up until today, I was born at a time where we have the tools to begin to understand, read and manipulate the underlying source code that makes us this way, genetic information. And I've spent my entire life working on doing that, understanding how molecules come together within our bodies to make us alive. My first company was called BioBots. We built 3D printers that print living tissues out of human cells. And I stopped working on that about a year and a half ago. And in that time, I have been journeying around the world, feeling a lot of those emotions that I would like to be feeling more of, and developing much deeper human connections than I was able to develop while I was working. And what I've learned is that I know what kind of lifestyle I want to live, and there's been one thing missing. I haven't felt like I have really been contributing as intensely as I could towards this path of creating a next generation, be that human or something else, that feels more of the positive emotions that we like to feel and fewer of those that we don't like. And I'm here to spend the next 2 weeks learning about these 10 wicked problems and diving deeply into them and seeing if any of my expertise as well as my values align with solutions that can help address them. Thank you.
Good afternoon, and thank you for joining us. My name is CJ Whalen, and before I get started, I just wanted to point out, did everybody catch the headlines today that our Congress passed and our president signed into law new legislation completely revamping our healthcare system? We all now have affordable, accessible mental and health care for everyone. It's April 1st, April Fools. The reason why that joke isn't that funny is because of all these wicked hard problems we're going to be addressing. And I am very excited and thankful and grateful to be a part of this cohort to do that. Again, my name is CJ Whalen. I'm from Centennial, Colorado, and I think most of you realize that's just down the road here. I've been in Colorado most of my life, went to college in Boston, but quickly came back to enjoy all that Colorado has. My professional career has been in telecommunications and software development in telecommunications. I also like to say I'm a recovering local politician, and I'm glad my wife is here tonight to see me kick off this next part of my life. And for fun, I'm an avid bicyclist, cyclist, and I love working on cars and anything I can tinker with. So again, thank you for joining us, and I look forward to the journey.
Good afternoon. My name is Selena Green. I'm originally from Queens, New York, and I've been spending the last 6 months in South Bend, Indiana. What brings me to 10-10-10 is I've spent the last 20 years working in the nonprofit sector and with social enterprises, primarily in international development. I've seen some of the wicked problems from both a domestic perspective and from an international perspective, and I've also seen some of the constraints that working in a nonprofit framework can have, restraints with regards to funding, restraints with regard to regulation, and I'm interested to see how taking a commercial or venture approach can perhaps unlock capital and unlock talent to address some of these challenges. I've been consulting for the last 4 years, started a firm called Teke Global to help nonprofits and social enterprises to reframe their thinking about how they might take a commercial approach to some of the challenges that they're working on. So I was glad to learn about 10-10-10 and ways that I could expand my network, expand my reach to potential co-founders and other supporters who are from a totally different background and sector than I'm in. And I'm very much looking forward to the journey and looking forward to sinking into these wicked problems and doing what I can to solve them. Thank you.
Hello, Denver. How are we doing? All right. My name is Rashmi Joshi. I started my first company when I was 16 years old, and since then have been completely enamored with the startup culture. After that, I actually started focusing more on IoT. I started a wearable tech company out of Seattle, and then shifted my focus to focus mostly on the software side of IoT. And in the last few months, I've been searching for my next sense of purpose, something that gets me excited when I wake up next morning. And I was very excited when I got a call from Tom, and I learned a little bit more about the 10-10-10 program. And I'm very, very, very grateful to be here, and I'm very excited to explore these 10 incredibly important and valuable problems over the course of the next 10 days. And I'm excited to explore some Denver gastronomy as well. So if you guys love to eat, come find me. I would love your suggestions, and I'm here to eat as well. So thank you, everyone, and enjoy the rest of your day. Thanks.
Hi, everyone. I'm Daniel Rothman, originally from upstate New York, now call New York City my home. I did my first startup by accident. I studied cognitive neuroscience. I thought brains were neat, and I ended up starting a sleep technology company. Back before wearables were really a thing, it was a smart alarm clock designed to wake you in the right stage of sleep so you'd wake up feeling better. Once I started my first company, I got hooked. I helped an astronomy professor commercialize a kid's toy. I shipped out west a PhD and ended up dropping out to do another startup in health tech. This was prompted by the preventable death of my grandmother. She went into the hospital, surgery went well, she was getting better, and then each day a little worse, and nobody noticed. So that was my catalyst that pulled me into health. I wrote a business plan, dropped out of my PhD program. The company now exists. It is an overlay on an EMR that reduces mortality in hospitals by about 30%. It's in 100 hospitals, but not the other 5,400 hospitals, which is probably the most frustrating thing in my life. We have a mix of healthcare people and not healthcare people. I'm in the category of I know healthcare, I know why it is rough. I don't learn lessons quickly, so I'm here to try it again, to see if I can do something to propel it to improve. Thank you.
Good afternoon, everybody. My name is Mark Washington. I'm originally from Seattle, Washington. I was born and raised on Lake Washington, right on Lake Washington Boulevard, and now I live in Washington, D.C. So I like to keep it very simple in that. My background is engineering. I studied civil engineering at MIT and studied engineering management at Stanford. And ever since have gone through a track of mostly finance and exploring other entrepreneurial ventures and investing. Most recently, I started a company, a marketplace company, that lets people hire personal chefs on demand. You can go online, book a chef, come to your house and cook for you. It's big in the Middle East. Started it in Dubai and grew it in London and throughout Kuwait, Bahrain, Qatar. I'm interested in 10-10-10 and the healthcare track in particular, because healthcare is something that it touches everybody. It's a very personal need. About 15 minutes before I came on stage here, I got a call from my closest friend in the world, best man at my wedding. I was the best man at his. We actually started our first company together, and found out that he has been in the hospital with liver failure. I haven't talked to him yet. I'm looking forward to talking to him in a few minutes. But those types of healthcare needs, some creep up on you and come out of nowhere. And so I'm really looking forward to solving some of these problems because they impact everybody and you never know when they're going to hit. And there's so much needed in this space to make it better for everybody who deals with it. So thank you.
Hi everyone, my name is Stephen Myhill Jones, and as you might have already detected from my thick, exotic sounding accent, I'm from Canada. The West Coast, across the water from Seattle in the city of Victoria. When I was 23 years old, I started a company called Latitude Geographics. I did a degree in geography, and over time we grew, and really it was about building software to help people use geographic information to make better decisions about the world around us. And I found it deeply impactful and deeply meaningful. We grew to about 140 people, about 1,400 customers around the world, from small municipalities to the United Nations, from Fortune 500 companies to Arctic researchers working on projects up in the Arctic. The company was acquired about 18 months ago, and I stayed on as CEO for about a year, and so I've been, and then departed the company just in September. And so I've had about 7 months, and it's been great. I've time with my family. I took my 8-year-old son to Africa for a safari for a couple of weeks. And really sort of the process of decompressing and unclenching from the whole experience of the sale and departing the company and things. And one thing I realized was really missing was this sense of purpose, and that's what got me up every day in the morning and got me excited. And doing some angel investing and some board work and things, wasn't doing it. I've always loved, I crave being part of building something and the community that comes with that and seeing something go from an idea to making a difference. And so getting connected with the 10-10-10 folks was really timely for me because I was really wanting to, I realized that I want to create another company. And I want to look beyond sort of this space of geography and mapping where I've had my career so far, and health really resonated with me because it's such a important and impactful realm. So really looking forward to the next 10 days here. And I've got to say I've been blown away by the program so far, and just meeting everyone today, the caliber of folks involved, it's amazing, and I'm just thrilled to be here. Thank you.
Good afternoon. I'm going to tell you guys a little secret. I've been all over the globe to entrepreneur events, and this place is on fire. You guys are absolutely killing it. The level of talent in this room is just beyond words. So I've enjoyed meeting everyone today. I've met tens of people, maybe in the 100 range, I don't know, but it's a lot, and it's amazing. I'm still kind of surprised they let me in this place. But I'm very humbled and grateful to be here. My name is Keenan Hopkins. I'm from Asheville, North Carolina. Started my entrepreneur career at the age of 23. by maxing out some credit cards. And I started an on-demand food delivery business. So I started with just myself and about 4 delivery drivers. And I sold the company in 2016. We had about 75 delivery drivers and about 25 staff in-house with full management, executive team, and everything. Since then, I've dabbled a little in commercial real estate. And I sit on the board of a nonprofit called Mama Maisha that tackles a very common challenge, which is but outside of developed countries, the #1 cause of death for women between the ages of 15 and 49 is pregnancy-related complications. And so we provide maternal health services and maternal health advocacy in rural Tanzania, which has been very rewarding. And so along with that, about 10-10-10, about a year ago from a previous participant, and I've been interested ever since. And so when I got the call, I was very excited, and I'm very excited to see what happens and where we go. So thanks for having me. I'm beyond grateful, and this place is amazing. Thank you.
Good afternoon. I'm Charles Sims from Miami. My background is in affordable housing development, real estate development more broadly, focusing in on kind of how to solve those problems in a very interesting way. The last company I was with, we focused on trying to find more technical solutions and financial solutions to how to bridge the gap between affordable housing and retail gaps in inner cities. So I'm really looking forward to 10-10-10, exploring how to solve these impact problems, and I'm glad to be here. Thank you.
Hello, my name is Blaine Workentine. I grew up in Boulder, Colorado. I graduated from Boulder High in 1987. I started a company called Heart Chart while I was in college, and ultimately, entrepreneurship was always in my blood. But I thought I needed to do more, I needed to learn more. So I went to med school. Became an orthopedic surgeon, and halfway through my 5th year of clinical practice, I decided that the perverse incentives were just too much to swallow. And I joined up with Population Health, started as the initial inaugural member of Jefferson School of Population Health. And I couldn't help but think about the technology that could scale many of the challenges that we have in healthcare. Ultimately, what I've discovered through the process of all my work over the last 17 years, which includes growing a $100 million vertical for a company called BrainLab and having 5 exits both in med device and digital health space, what I've learned is that actually we need to go to the consumer. And so I'm here basically to solve these problems, because I think without a network of people to do this, it's really impossible to drive the kind of change we need to have in healthcare without being the consumer being the central part of the puzzle. So I'm really looking forward to being here, and couldn't be more excited. I moved back to Boulder in October, and I'm ready to rip. Thanks.
So what I heard is that we have 2 people that can make corny jokes, 1 Canadian, at least 1 guy who went to the prom in the 80s, and a whole boatload of startup grit and mission-driven passion, which has me so excited about this program. So let's give it a big oh health yeah. Oh health yeah. So this is the funnest part of every 10-10-10 event. This is the selfie break. Stretch, take a little snap, hashtag it. There's hashtagging it. Tag it something. And someone give me the next slide. And while you're doing that, no, seriously, stand up, stretch, take a picture. Like, hello, does anyone hear me? I am not your CEO. You can listen to me. I am not your mother. There you go. Then you go after that.
Coming into 10-10-10, I thought I had an idea of what I was getting into, and I was wrong. It was harder than I thought it was going to be. It was more inspiring than I thought it was going to be. 10-10-10 is an incredible opportunity, not just for folks that are sitting in my seat, but also for anyone who wants to see how it is that we can address these big, hairy problems.
We all know that cities are stressed and strained. It's only going to get worse. There's a real need to really assemble top talent to put together some creative ideas.
One of the reasons why I joined this program was finding other people that have a similar mentality, where a lot of people just don't want to deal with anything really difficult and pretend like there's not a problem, but these are people who are really attracted to fixing something of that nature.
I think anyone who looks at these problems and doesn't get a little nervous, not only on whether or not we're going to be able to step up to the plate and solve them, but also what happens if we don't solve them? There is a level of urgency there that's not just because I'm standing alongside a bunch of really incredible entrepreneurs, but also because if it's not going to be us, who's it going to be?
So, I left something out. I'm going to say it in brief. Part of what we've learned over the course of the last 4 years, a really important thing we've learned about these complex adaptive systems, is that people need context to better understand the problems that we're asking them to address. And the way to do that, just as is true in the real world, and Stephen probably knows this better than most of us, understanding where you are in relationship to where you want to be matters quite a lot. We usually do that with maps. And what we've done is we've learned that complex adaptive systems can be mapped, and these systems maps can actually show the dynamic properties of the systems. So we now have, in a way that we've never had before in our program, these systems maps. We have a map of the complex adaptive system that is health, and it's not perfect. It'll get better and better and better through time. We have a network map, and it's not complete, but it will become more complete through time. And we're going to use these tools, the entrepreneurs are going to use these tools to get a clear understanding about each of the wicked problems. And we're about to show you these wicked problems. That's what's coming next. But I want you to know that these maps, these systems maps, these network maps are something that folks here have worked really hard on. Our validators have participated in helping us create these and understand them. A whole bunch of volunteers have helped. And by the way, that's really important to point out. I mentioned the sponsors earlier. All of this happens because of an incredible amount of volunteer talent. And I really want to honor and thank both the ninjas. By the way, anybody who's a ninja here, would you stand up? Just do that. Stand up for me, please. Lots of ninjas, right? And validators. Anybody who's a validator here, would you please stand up? Thank you very much. Okay. So I wanted you to know about this, and when you look at the wicked problems, when you hear about them, you will see these things that we unveiled that will show you each of these wicked problems in a new way. That's an important piece of what we've done that we've never done before. So I look forward to the rest of this.
So much going on. Let's just get right to it with validators and wicked problems. Who's up first?
Hey! I'm here to talk to you about social isolation in the aging population. But before I do that, let's talk about demographics. and what everybody thinks is a big problem that's emerging with demographics. Why is that so important? In the year 1960, the demographic shape profile of the United States was a pyramid. Yes, I was on the bottom rung in 1960. In the year 2060, the shape of the population dynamic is anticipated to go columnar. So from a pyramid to a column. And no, I don't plan on being on the top rung in 2060. I'm not sticking around that long, thanks very much. So why does that matter? Well, in the year 2035, we are going to turn demographics on its head in this nation. That is the year that people over the age of 65 are anticipated to outnumber the people under the age of 18. That's never happened before. This is a growing and a dynamic problem. So why does that matter? In the last 50 years, the number of single resident households has doubled. In the next 50 years, it's anticipated to grow by 57%. 2/3 of that growth will be in the aging population. But we've got millennials. Millennials arguably have a bigger footprint than us boomers. And guess what? You millennials aren't getting married. So guess who's got the fastest growing rate of single households? It's not us boomers. It's the millennials. Okay, why is social isolation a problem? It's the equivalent, some researchers have said, it's the equivalent of smoking 15 cigarettes a day. 15 cigarettes a day. Increased incidence of high blood pressure, increased incidence of type 2 diabetes, increased incidence of cognitive decline, increased incidence of mental health issues, including depression and suicide. That's a significant cost to us. Why does that matter? Who here has heard of Medicare? Come on. Everybody, I hope. You all pay for it, right? In 2017, the AARP did a study that indicates that the cost of those living in social isolation in single households on Medicare is an average of $6.7 billion a year. That's costing us. That's costing all of us, right? It's an extra $6.7 billion a year. Well, why is that? Because they're in assisted living. They're in nursing homes. So who will join me in not going gentle into that good night and rage against the dying of the light? Will you join me?
Good afternoon, everyone. In January of this year, 2 middle school students in the Four Corners area died by suicide over a holiday weekend. And in October of 2018, 2 seniors at Arapahoe High School and Centennial died within 3 days of each other. 2 months before, a 9-year-old boy took his life after being bullied in school after revealing he was gay. And over the past 2 weeks, 4 more Denver area teenagers took their lives. I would like to start by taking a moment of silence for these children, their families, friends, and the communities they have touched. Three years ago today, I was asked a very important question by one of the 10-10-10 CEOs. What keeps you up at night as a pediatrician? I paused briefly and responded, it's the growing number of kids and adolescents I see every day with depression and anxiety in my practice. Fact, 1 in 5 children in the United States have a diagnosable mental health disorder. Fact, 50% of all lifetime cases of mental illness begin before the age of 14. What we now know is that child social and emotional development begins at conception, if not before. Fact, an estimated $247 billion is spent each year on treatment and management of childhood mental disorders. Fact, lack of attention to early social emotional development leads to an 8 to 10-year delay between the onset of symptoms and treatment. With early detection and intervention, we know we can improve outcomes. Fact, in 2016, suicide was the second leading cause of death among individuals between the ages of 10 and 34. This problem touches everyone, and children are at highest risk due to the fact that their brains are still developing. So I ask you, why is now the time to tackle this wicked problem? And why is it more important than any other? Because childhood mental and emotional distress is at epidemic levels, and our children are dying. Safe to Tell Colorado has seen suicide-related reports jump 9-fold in the past 6 years, and Children's Hospital has seen the number of patients who have attempted suicide soar 600% in the past 10 years. We know that lack of funding and a shortage of providers are a few of the big barriers to solving this wicked problem, but we have no choice. These children are our future. Please join us in solving this wicked problem.
So I'm here to talk about sleep. So if I could promise each and every one of you a good night's sleep tonight, who'd be interested? All right, why? Because you know how important sleep is. So we recently conducted a survey of tens of thousands of people in 12 countries. 80% of them said they're not getting good sleep. They want better sleep. 69% of them said they're actively trying night after night to get a better night's sleep. This is a huge problem for us. Now, you may think that losing 2 hours doesn't really hurt you that much. You can function well the next day, pound a little bit of coffee, you're irritable with the kids, and you make it through. But in fact, what you may not know is that sleep debt is cumulative. Night after night, it builds up like a pressure cooker. 2 weeks of 2 hours sleep debt in a row will make you look and function like you were up for 24 straight hours. That's been shown. Sleep debt hurts our health. The two top leading causes of death in the United States, heart disease and cancer, have been linked to sleep loss, to chronic sleep debt metabolically. The third, accidents, has been linked to sleep loss. The Exxon Valdez was related to sleep loss. Space Shuttle Challenger, a cruise ship running aground off the coast of Italy, all linked to sleep loss. If you look at the workplace productivity is lowest and accidents are highest during the night shift. Sleep is killing us, and we're not paying enough attention to it. Now, why do I think as serial entrepreneurs you should be thinking about this right now? It's the right time to do it. Sleep, the world is your marketplace. Everyone sleeps. I told you 80% of the people are having problems, okay? So it's the prime time to do it. I'll also mention that, and you know this very well, nightly people are tracking their sleep. The technology exists. You can get feedback on your sleep every night, and it's not bad feedback. It's good technology. But the solutions exist too. People are not getting the solutions. And the last thing I'll say about why you should do it now is the investment is there. Companies like Apple, Google, Philips, who I work for, Samsung, J&J, they're all investing right now in sleep for solutions because we know that we need these solutions. So if you still don't think it's a priority, I'll ask you two simple questions to think about. How many hours of sleep do you need yourself, everyone knows their answer, to wake up feeling refreshed? Now think of how many you get. Thanks.
All right, so here's what happened. Back in the 90s, pain was added as the 5th vital sign. Any patient who went to a doctor would have his pain rated on a scale, and that number was added to his chart, right next to heart rate and blood pressure. Physicians and practices were graded and reimbursed based on patient satisfaction, including how well pain was managed. There was intense pressure on docs to manage pain. So then come the opioid manufacturers, and they've got the miracle solution. Hi, we have opioids. They are safe, they are effective, they're miracle drugs. Docs were told that they'd be effective at managing chronic pain, that they were safe, that they were non-addictive. And of course, now we know that those were all lies. Opioids, while they can be effective at managing acute pain, they're not very effective at managing chronic pain. They are not safe, they are highly addictive, and they're really hard to stop. Like, really hard. Have you ever tried to quit smoking? So if you know how hard quitting smoking is, and if you haven't yet, that's my other soapbox that I'll happily help you with. If you thought quitting smoking was hard, imagine being dependent on a substance that in many instances is illegal. You can't go into a pharmacy and just buy a replacement product. You can't tell your friends and coworkers about it because there's so much stigma. Well, opioid use disorder affects everyone, all races, genders, income levels, ages. I'm willing to bet that a good portion of the people in this room has been impacted in some way by opioid use disorder. This disease, and let me be clear, it is a disease. It is not a moral failing, it's not a character flaw, it's a disease. And it impacts not only individuals, but families and whole communities. Over 47,000 people in America died in 2017 of an opioid overdose. Those 47,000 people were somebody's mother, brother, uncle, best friend, sister, child. They were all someone's loved one, someone who probably wanted to help and just didn't know how. And the complexity of OUD is so difficult to put into words. This small system map here is just a piece of it. And even if you look at the full system map, there's no way to fully encompass all the components of it. Is it a public health issue? Is it a healthcare issue? Is it a mental health issue? Is it a law enforcement issue? Is it an education system issue? Is it a government issue? The problem is it's all of those and more, which means that a lot of things could help, but no one thing will fix this. Colorado has some really promising practices. We've got a promising practice in our emergency departments, promoting alternatives to opioids with the underlying philosophy that, hey, you broke your arm, it's gonna hurt. Pain is okay, pain is normal. We need to get away from that mindset that pain is bad and we need to eliminate it. So you go into an ED in Colorado and you will get something to ease the pain, but it will not fully eliminate it. And there are many alternatives that are good at easing pain, but we're never gonna you don't need to expect to see that fully eliminated. And through that, we've seen a dramatic decrease in opioid prescriptions out of EDs, but that's just one piece of the 1,000-piece puzzle. We have an increasing number of diversion programs, co-responder programs, problem-solving courts in our communities in Colorado, and so we're keeping a record number of people out of jail and getting them help instead. But that's just one piece of the 1,000-piece puzzle. The overdose antidote naloxone is available with no prescription in almost every retail pharmacy in Colorado. Again, one piece of a 1,000-piece puzzle. So now that I've made it sound completely unsolvable, it's not. And this is the time to tackle this wicked problem. The need is there, the will is there, and the commitment to collaboration is there. We have a lot of the pieces and we just need the rest, and this is the right time for it. Thank you.
Good evening. In 1998, the Institute of Medicine released a landmark publication on preventable medical errors in the United States. And in that publication, it released that we, as the United States, have killed 100,000 people per year based on preventable medical errors. That is like crashing a 747 every day for 365 days a year. These numbers were just recently updated by Health Affairs and Johns Hopkins, and the numbers were quite staggering. It wasn't 100,000 preventable deaths, it was 250,000. That means it would be the third leading cause of death behind cardiovascular and cancer. So people don't just die because of a heart attack or bacteria. It is because of the systematic failures in the system and the fragmented care. Now, there are contributing factors. It could be because of clinical variation in which you're receiving one type of care in one health system and something completely different in another. It could be, as another contributing factor, physician and clinical burnout. Our folks give a lot, our clinical teams give out a lot. At the same time, they may be burnt out. Or you could also go to the vast array of data and the ability to put all of these things together to synthesize it at that point in time for that patient. Now, I love the passion of the personal ambition of each one of you. It's also what is the market opportunity. If we look at the US healthcare spend on healthcare alone, it's roughly $3.4 trillion, 18% of GDP. But what does that mean compared to what? If you took the US healthcare spend alone, put it as a nation, it would be the 5th largest nation in the world, right behind Germany and right before Great Britain. In the article that was the updated numbers in terms of Health Affairs and Johns Hopkins research of the updated numbers of preventable medical errors, of that 3.4 trillion, they are estimating 1 trillion is due to preventable medical errors. So in this wicked problem, it's quite simple, at the same time complicated. And then when it comes to the delivery of care, how might we make the right thing to do the easiest thing to do? Thank you.
Good afternoon. Good afternoon. Hello. I'm Carrie Pykoch with the Office of eHealth Innovation in the Governor's Office. I report directly to the Lieutenant Governor's Office. The wicked problem that I'm here to talk about is misaligned health incentives. Maybe a new topic, but I can find more flavors and information about Doritos than I can find out about accessing health care as a consumer, as well as the impacts of Doritos. So, no chuckles, so I'll keep going. So let's imagine a world where consumers the biggest decision about healthcare is the flavored of infused water that they get at their gym. Instead, we've got providers overprescribing based on fear of malpractice. I think there were some studies done that showed over about 20% of overprescribing is just due to fear. From a Medicaid as well as an insurer perspective, we spend in the state of Colorado billions of dollars on healthcare, where we're starting to shift towards education, towards transportation, and we need the help of everyone in this room. I think all the wicked problems described to date requires some spotlighting on the particular value. Currently in healthcare, as you all are potentially aware, that we pay for volume, for service, instead of outcomes. So as someone described, horrible things happening to their grandmother or to their loved one, insurers still get paid for that. And then providers, they're less and less. I saw a stat related to the number of providers since 1975 has only gone up 150%. So not only do we have a workforce shortage, we also have an increase in healthcare administrators. So since 1975, there's thousands % more of those making sure that payments. So the system is kind of rigged. So I'm begging you today to consider, let's spotlight some areas where we can really show value for our citizens, for our consumers, and break free some of these outdated processes. And we're right here with you. So misaligned health incentives, I think that, for those that don't like Doritos Locos, this is a great room for that. In our rural and more, safety net communities, that's all they've got. It's, convenience store food, not necessarily the means to make those healthier decisions. So that's my plug, and thank you all for letting me talk today.
earlier, healthcare costs in the U.S. continue to rise. This puts state legislators in a very difficult position of deciding between healthcare spending and other vital infrastructure. In the state of Colorado, as an example, Medicaid comprises 33% of the state's budget. While these costs continue to grow, so do our understanding of the types of activities that actually support health. And in many cases, these activities don't take place within the clinic or hospital setting. In fact, research shows that only 20% of your overall healthcare outcomes are actually driven by healthcare services. Things like your job, your family supports, and your community are much larger determinants on your overall healthcare outcomes. Coordinating healthcare with the types of services that address these social needs are vital to bringing down the overall cost of healthcare, but more importantly, to achieving real and sustainable healthcare outcomes for families. Since the Affordable Care Act, healthcare systems have been moving away from volume towards value-based systems, and they're increasingly responsible for the overall health and well-being of their clients. At the same time, they're ill-equipped to assess an individual's non-clinical needs and connect them to non-medical services in their community, such as housing, food, or employment. Providers, additionally, report that these are uncomfortable conversations. They don't know how to ask their clients these tricky questions, and they don't know where to refer them if a client does actually open up about their complex health or their social problems. A lack of training and comfort amongst providers makes them reluctant to see themselves as part of a larger and broader definition for care coordination. That being said, many organizations are moving forward with a broader definition for care coordination. And what we see is that there are core and common core components of a more integrated system. For example, we need reliable screening tools that can be integrated into electronic health records. We need databases and directories of reliable and comprehensive resources in the communities. And we need a way to share information between healthcare providers and community-based organizations. Well, one thing is that it's challenging. Despite these commonalities and core components, many organizations struggle to understand and assess the landscape which they exist in. What that leads to is a duplication of efforts. We see many organizations building parallel resource referral systems. They're using duplicative and inoperable technologies, and they're wasting resources. The wicked problem of care coordination, and specifically the de-siloing of healthcare from services that address these social needs, is critical for reducing healthcare costs and making overall health improvements. Now is the time for us to think and aim for whole person care coordination. Thank you.
Hey everyone, my name is Jim, and I'm going to tell you a couple of stories. I'm the former president of iTriage, which is a Denver-based health tech startup that was sold to Aetna a few years ago. But more importantly, the iTriage product itself was pretty much the first, the reason why we built it, we wanted to tackle health illiteracy. By the way, how many people in the room, by show of hands, think they're health literate? Anybody? All right, across the country, 12% of us, only 12% of us are actually health literate. The rest of us are illiterate. Can you believe that? So the reason we started iTriage was to tackle the problem, and we basically had, we wanted to help people answer 3 questions. What could be wrong with me? What do I need to do to fix myself? And where can I go to get help? And that's the reason why I'm incredibly passionate about health illiteracy. By the way, does anybody know how big the problem is for health illiteracy? How many billions of dollars are spent each year on health illiteracy in the US alone? Anybody? Guess? 3.5 trillion. Close, but no. 238 billion, the biggest problem here. 238 billion, that's 7% of the 3.5 trillion spent on US national health expenditures each year. That's problem number one. Problem number two, it's very personal. Everybody here probably has a story about health illiteracy with their friends and family themselves and how it's impacted them, sometimes with dire consequences. For example, a friend of mine 3 months ago, 50 years old, athletic, great shape, went for his first colonoscopy. Unfortunately, he was diagnosed with stage 4 colon cancer. So as he started his treatment plan, he finally found out that he had a history and a family history of colon cancer. If he had known this before, 10 years ago, he would have gone for annual checkups and it probably would have prevented. Story number two, father-in-law of mine, or a friend's father-in-law, 72 years old, in the hospital for chemo complications, asked for his wife to be there before he's intubated. His wife never makes it. He's intubated. 11 days later, the family takes him off the ventilator. He dies. 6 months later, the mom, in a box in the garage, finds the advanced directive DNR to actually take him off and not even to go on an intubation. Story number three, more close to home. A friend of mine who's in the healthcare system has flu-like symptoms, cold symptoms, maybe Lyme disease, because she just came back from Pennsylvania, which is a state that has high incidence of Lyme disease. She says, I'm really literate. I'm going to go to an urgent care for $75, and it'll take 15 minutes. She went, had a great appointment, came back. 2 months later, she receives two exorbitant bills, one from the emergency medicine physician for the 10 minutes she spent with the ER doc, and the second bill from the health system for the freestanding ER that she went to. So thousands of dollars for billing for a $75 problem. So in conclusion, this is the biggest health problem, $238 billion, affects all of us. There are so many opportunities to solve this problem in every part of healthcare. So my challenge to you guys is, which one of you is going to step up, come up with a solution, and try to solve this wicked problem? Thank you.
Hi, how are you? Good morning, or good evening, that is. I am honored to be with you tonight in this room full of inspiring and amazing people. People who believe in good. People who believe that our society can and must do better. Today, I'm here to implore each of you to tackle the wicked health problem of health disparities at the point of care. So what this means is that some individuals are treated unfairly when they're seeking care, and that treatment causes their health to be poorer, and it causes their health care costs to be higher. And so this is a really, really wicked problem that has many, many different reasons for being, and you can see in all these systems maps, they're all very complex, right? But if I were to boil it down, the reasons why I think this problem exists is because of the conscious and unconscious biases that we have in our society on many, many levels. So for instance, on the personal, individual level, a doctor may unconsciously treat somebody differently because of their sort of perception of race, class, gender, ability, etc. They don't mean it, it's unconscious. And then these disparities also exist because of the way our organizations, our institutions, and our society are designed to treat some groups better than others, to norm some groups over others. It's a very wicked problem, and I'd say that minorities and people of low incomes are the ones who most palpably feel this problem. But it's a problem that affects all of us. Our whole society suffers from health disparities at the point of care. For instance, in 2011, it was estimated that $35 billion were lost to unnecessary healthcare expenditures. Additionally, it was estimated that $10 billion were lost to, or $10 billion of lost productivity due to illness. So this is a truly, truly wicked problem, and I would venture to say that it may even be the most wicked problem that we have to present to you today. I know I'm biased. But if you think about many of these other problems that have been presented, you could put this lens of health disparities at the point of care onto it. And I believe that if you fail to do that, you will create solutions that perpetuate the inequities of our system. So I'm here to implore you to think about who is affected by your wicked problems. And are there certain groups that are disproportionately affected compared to others? And if so, why? And what could your solutions do to remedy that? So please, tackle health disparities at the point of care and help us to have more fair and more just care for all. Thank you.
Good evening. I'm Cole Chandler.
I'm Benjamin Dunning.
And we are the odd couple that's going to bring you home this evening. You've done a lot of listening. We are the 10th wicked problem, and that problem is housing insecurity. We are in the midst of a national housing crisis. Nationally, we are 7 million units short of housing from 0 to 30% area median income. Nationally, we have 550,000 people experiencing homelessness on a given night. Now, these problems land locally as well. Here in Metro Denver, we are over 60,000 units short from 0 to 30% AMI. That's enough households to put a single person from every household in the Mile High Stadium. So it's a pretty significant issue, right? In Metro Denver, we have 5,300 people experiencing homelessness on a given night. So this is a national problem, and it shows up in local communities. But the reality is that this problem that we're facing in our country, it hasn't always been this way. Countries around the world don't face housing insecurity the way that we are, and we haven't always faced it this way in the United States either. And so when we look back in our history, the previous time period where we faced housing insecurity at a time like this was actually in the midst of the Great Depression. In the midst of the Great Depression, we faced housing insecurity at levels like we're facing it now. What followed the Great Depression was New Deal era policies that built infrastructure and housing and gave jobs to people all across our nation. Those policies continued to guide us for the next several decades, but in the late 1970s and early 1980s, we made drastic cuts to the federal housing budget that have never been replaced. And so that's produced the problem that over the last 40 years has led to this issue that is showing up nationally and locally. And I invited Ben to share a little bit about how that's showing up in people's lives and people's stories.
Yeah, hi. This is my housing story. Started out normal, and it looks like what it looks like today. I grew up in a brick tract home up in Federal Heights. My dad was a working accountant. My mom worked part-time sometimes. When my sister was born, my brother and I were fighting too much, and they were able to move 6 blocks away into a larger house, no problem. I went to college here in town, spent 2.5 years at the Colorado School of Mines before I finally flunked out, then finished up at Metro State. Upon graduating, I went to work for $4.50 an hour and was able to afford an apartment. Got a slightly better job, got married, bought my first house for $60,000 up in Thornton. About 4 years later, my first marriage dissolved and had some financial debt and things built up. Sold that same house after 4 years for $90,000. Was able to take the equity that I built in my house and use that to help get through a life crisis. Got married again. My wife owned the house, and she bought it for $185,000. The economy began to take a downturn. It was hard to find well-paying, steady work. Was working a lot of odd jobs, call center jobs, a lot of labor jobs. And in order to make ends meet, we refinanced the house for more than it was worth. At the time, it was worth $200,000 when we refinanced. That was after about 3 years. And we refinanced it for $210,000. You can see what's going on with all this stuff and the housing stuff. Well, through various other things, we struggled in our marriage, and finances were a big source of tension, and the marriage broke up. I wound up in some legal trouble, and then after that, had taken on a labor job just around the time of the housing crash. Had a bike accident, which gave me a head injury that caused me to lose control of my right arm, and so I could no longer do the heavy labor that I was doing at the time. Went homeless, the job market dried up. And so there's more of my story there, but we only got 3 minutes. But one other thing is on the streets, I found a lot of people have been talking about community solutions and things like that. And that's one of the things I found out on the street, different kinds of thinking, different kinds of issues. But hopefully that gives you a view of the scope of how things have just slowly changed over a lifetime.
So Ben's story shows that this is an intricate problem that's interwoven on a lot of different areas. It's family systems, it's an economic system, it's a housing system, it's a healthcare system, it's a criminal justice system. It's all of these things bound up with one another. I'll tell you one final story. My wife works as a nurse at the Colorado Coalition for the Homeless, and they serve folks in a primary healthcare setting that are facing housing insecurity every single day. Remember Ben's story, he ultimately ended up not being able to work because he didn't have the access to healthcare that he needed to get better. Every single day, my wife sees stories like that of people coming into the clinic that just need access to healthcare so that they can get back into the workforce and get back into housing. But the reality is that we don't have that access to healthcare. Many providers in her setting say if we could prescribe one thing for these patients, we would prescribe housing. And so what I invite you to do over the next 10 days is to tackle this wicked, intricate, interwoven problem that would produce greater health outcomes for 7 million people across our nation. Thank you.
Well, damn, those problems were pretty wicked. Good thing we don't have a song and dance medley of wicked problems prepared like they would do on the Academy Award, because that would have been awkward. Those are some amazing problems. We've got some amazing entrepreneurs here ready to tackle them. A little bit about what's going to happen over the next 10 days. These guys are going to dig in and hopefully find one of these wicked problems that is a fit to who they are as a person, who they are as an entrepreneur. And if not, like me, they will make up one of their own, which is equally as wicked. They're going to get help from the ninjas and the validators. And they're also going to get help from probably a lot of folks in this room. Tom had y'all stand up already, so I'm supposed to tell you that after we break, for anyone in the audience, there's going to be Post-it notes, and these boards from the wicked problems are up on the back wall there. And you should go up and put a Post-it note with any thoughts you have, any resources you know, with your contact information on any problem that you have got expertise and insight that you can provide to support these 10 folks over the next 10 days. Yep. And then I want everyone to come back here in 10 days on April 11th for the grand finale. And they're going to put a slide up that gives you a little code so you can get in with a discount. And now Tom is going to wrap up.
I got it. Test. Yeah. I don't need this. I don't need the cheat sheet here. I want you all, please, to give the entrepreneurs, the prospective CEOs here, and the problem advocates who pitched today a huge hand. So these folks have their work cut out for them. The world has its work cut out for it. None of this is trivial. To make this happen, to get them where they need to go, we have a core of ninjas who can move the ball forward. And fortunately, we have this display here. These are our ninjas. I am absolutely delighted that they've been able to join us and volunteer their time over the course of the 10 days. Thank you all very much. Let's applaud for those folks, too. And then Our validators make this a real possibility. The validators are the folks who have subject matter expertise and can dig deeply into these topics as the prospective CEOs decide which of them is a fit. So again, applause for the validators. Thank you very much. So this is the beginning of a 10-day process. It's really 11 days, and it concludes, interestingly enough, on the 11th. So those of you who can, come back here with a friend. Come back here to this place at 5 p.m. on April 11th. So if you don't have your ticket yet, get it. But please do come back and join us, and please do promote this. We'd love, actually, to see an even larger audience for the finale than we've seen here today. We're delighted that you're here. We have a reception afterwards that'll be a big deal for us. It'll give us a chance to talk with you, our prospective CEOs, a chance to connect with all of you. Don't forget to use the wicked problems and the maps that you see back there to put up Post-it notes, as you've heard. And am I leaving anything else out? Are we good? Oh, I should look at the slide. And yes, huge, huge, huge. These are the people who have broken their, I mean, they've done everything. They've worked in sleep-deprived hours over time to deliver what we're doing over the course of these 11 days. And I want to thank each and every single one of these folks, except that guy in the lower right-hand corner. So applause for that crew, too.